It's hard to say how concerned we should be. I mean, obviously, if the virus becomes more contagious, that's not a good thing. But there's no evidence as of yet that the virus makes more people sick, that it causes more severe disease. And there's no evidence yet that it's going to invalidate all the vaccine work that has been done up until now. So if it doesn't make people more sick, if the vaccine is going to be equally effective with this variant, it's unclear what kind of impact it's actually going to have. The virus may spread more easily, but the thing that we have to remember is that the infectiousness of a virus, the degree to which it spreads, depends not just on the characteristics of the virus, but also on our behavior. Remember, this virus spreads from person to person, so if you stay home, if you don't come into contact with other people, you can't get sick no matter how infectious the virus actually is.
Still, though, that is the health of the individual. Let's talk for a moment about the health of the system in terms of if people don't entirely follow the directives and occasionally get together with a few people over the holidays and the virus, this new variant, is out there. Could we see a palpable effect on the healthcare system in terms of increased numbers that we maybe hadn't accounted for?
Well, I think we certainly could, and that's the big worry. If people do gather together, if they decide to celebrate New Year's Eve, which they definitely should not do, but if people do decide to do that, if this virus is more infectious and can spread more easily, we're going to see more cases. We're going to see an even larger spike in January than we had potentially feared would happen. And that's going to land more people in the hospital, put greater strain on the healthcare system, and contribute to the growing problem we have of burnout amongst healthcare workers. So there is, I think, some degree of concern that we need to pay attention to. But I think also the important point to keep in mind is that the same things that were true a week ago are still true today. The basic measures that we need to put in place are the same ones, which is keep your distance, wear your mask, wash your hands. Those three things are going to largely contribute to preventing the spread of the virus, no matter which specific variant may be circulating in our community.
Okay, let's talk about terminology there, because you say variant. So in terms of the difference between a strain, a variant, and a mutation, can you walk us through that?
Sure. So a mutation is basically a genetic change. So all of us, humans and viruses and everything in between, have a genetic code. And so anytime that genetic code changes spontaneously, that's called a mutation. And so viruses are mutating all the time in the same way that we are mutating all the time. Our genetic code does change from generation to generation. So every time the virus replicates, there is a small change in its genetic code. And most of these changes don't mean anything. They have no real significant impact. Although every so often you have a genetic change that actually does mean something. And what you're seeing now with COVID-19, with the coronavirus that causes COVID-19, is that you're seeing a specific set of genetic mutations that has made it a little bit more infectious. Now, there's actually a lot of different strains of coronavirus, and all of these strains are slightly genetically different. And so what happened in Southeast England, presumably, this hasn't been officially confirmed yet, but what seems to happen was that you had a series of genetic mutations that made that particular coronavirus or that particular strain of the coronavirus more infectious, which means it outcompeted all of the other strains of coronavirus that were circulating around in the community, and it made it the more common one. So that's what has led people to hypothesize that it's slightly more infectious. It should be pointed out, though, that none of this is actually unexpected. This is what happens with every virus, with every infectious agent. Remember, every year we have a different strain of flu that becomes dominant, that spreads around the world. So this is what normally happens. We just want to make sure that it hasn't mutated into something that's particularly more dangerous. And so far, that doesn't actually seem to be the case.
Okay, so from a virus point of view, it's a case of survival of the contagious. But as we now roll out vaccines that we hope will cover this new variant, we know that in Ontario, some vaccine clinics were closed for the holidays. Can we talk about what effect that might have in terms of reduced vaccinations during the holiday season?
Well, I think you have to realize that as people, have holidays, as they have time off, yes, you're going to have a bit of a slowdown over the holiday period. I think that was to be expected. I mean, I certainly expect that come the beginning of January, things are going to ramp back up to what they were before. And of course, as we get more and more vaccine doses shipped to Canada, you're going to see more of these clinics open up and be given to people. So, you know, we had our initial start, and then I think that was important to show people that the vaccines were here and we're ready to go. But I think you're going to see the real push start coming January, February, and into March, where there's going to be this real push to vaccinate at least the high-risk segments of the population and try to get this virus under control from that perspective.
Okay. Dr. Labos, thanks as always. Really appreciate it.
My pleasure. Take care. Stay safe.
You too. Dr. Christopher Labos is an epidemiologist and cardiologist.